Morning, everyone. Are we we're good to go?
I'll give you a countdown to the line.
Sounds good. We're good to go? Okay.
Yeah.
Thanks, everyone. Thanks for joining us. I want to begin, as we always do, by acknowledging that we're on Treaty 1 and Dakota Nation's territory and the homeland of the Métis Nation. I'm joined by Jay Shaw, manager of the City of Winnipeg's Emergency Operations Center. Jay will have a more substantive update in a few moments. I do want to begin today's press conference by just reminding Winnipeggers about the current state of COVID in our community. We continue to get updates from provincial health officials. In terms of Winnipeg, we have had a total case count to date of COVID of 50,019. Sadly, we have lost 868 of our residents to this virus. There's currently 252 individuals in hospital, 30 in intensive care units as of January 5th, so yesterday. Manitoba's test positivity rate has moved from 24.2% a week ago on December 29th to 40.3% as of yesterday. Winnipeg's test positivity rate has moved from 26.2% a week ago, December 29th, to 48% as of yesterday. Fortunately, many Manitobans and Winnipeggers are, however, getting their vaccines. Manitoba's vaccination rates for double doses is currently 77.8%. Winnipeg's vaccination rate for double vaccinated is 84.9%. Manitoba's vaccination rate for 3 doses is 26.1%. As I often do, I want to just begin by commending all of those who have gone and got their vaccine in order to protect themselves, their families, their friends, and the rest of our community. And here's the reason why it's so incredibly important that Winnipeggers continue to step up to get their shot. According to data provided by the provincial government, people who are not fully vaccinated are 2 times more likely to test positive with COVID-19, 14 times more likely to be hospitalized, 39 times more likely to be admitted to an intensive care unit, and 36 times more likely to die with COVID-19. The evidence is crystal clear. Go get vaccinated. One of my last messages on social media for 2021 was asking Winnipeggers to continue to support local. Also, I asked people to stay home without guests for New Year's Eve. I want to begin just by thanking all of those who answered that call by celebrating New Year's Eve by supporting local, but also staying home without guests. And I'm going to continue to remind Winnipeggers of the importance of supporting local businesses that need our help right now, but also to continue to ask Winnipeggers to do their part by limiting their contacts, including within your personal residences. Just because the provincial orders may allow you to have people over to your homes, I want to encourage you to continue to limit your contacts, including in personal residences. It's one way in which you can take some greater semblance of control in the situation by limiting your contacts and trying to do our part to limit the spread of Omicron right now in our community. And the reason that's incredibly important is it's really for the purposes of preserving capacity in our healthcare system. The focus of these updates has been regarding the impact of COVID-19 that it's having on City of Winnipeg services that our residents continue to depend on each and every day. The City of Winnipeg Public Service has continued to take measures to mitigate the impacts on the critical services that a municipal government provides, continuing with remote work measures that are still in place. The continued focus on distancing, masking, and hand hygiene is continuing. And then also taking the measure of having a vaccine program for all City of Winnipeg employees, something that we're doing to help better mitigate the risk of the virus to our employees, as well as the critical services that we provide on behalf of the residents that we serve. The city has been carefully managing service delivery, but as we've seen in the broader public, we're not immune to the absenteeism related to illness associated with COVID-19. Yesterday, we heard from the Winnipeg Police Service and learned of the extra steps that they're taking to ensure continuity of service as a result of illness. And while it's difficult to compare our non-emergency departments with the Winnipeg Police Service, we're not seeing the need for the same type of measures, but overtime is being used as needed, and city staff are working from home where possible. Staffing challenges are certainly increasing, however. The city has been able to mitigate these challenges so far. The focus continues to be on the safety of our employees and residents while ensuring the continuity of services that Winnipeggers depend on. Part of that focus is continuing to provide support to the provincial government and provincial public health officials where we can as a municipal government. Over the past year, this has come in the form of many things like making city buildings available, supporting provincial enforcement of public health orders and triaging through 311, and ensuring the provision of critical services that we're responsible for, just to name a few. But we all need to be supporting the efforts of provincial public health officials and our healthcare heroes by limiting our contacts, staying home as much as possible, and getting fully vaccinated and boosted when you're eligible. I got my booster shot yesterday with my wife, Tracy, at the RBC Convention Centre. I want to thank the staff and the volunteers for the outstanding work that they're doing at that centre and throughout our community to get people vaccinated as quickly as possible. There was a lot of people that were there rolling up their sleeves yesterday to get their shots and their booster shots. I want to thank everybody that is doing that, and just continue to encourage people to get out and get your shots when you're eligible. We're not through this yet. A booster is one way in which you can mitigate hospitalization and death as a result of Omicron. It's another way that you can help preserve capacity in our healthcare system for those that need it. So please get vaccinated, get your booster when you're eligible. With that, I'll now turn things over to Jay, who's going to provide you with some more details on the impacts to staff that we're currently experiencing, and then we're both available to answer your questions afterwards. Thanks. Merci and miigwech.
Thank you, Mr. Mayor. Good morning. My name is Jay Shaw. I'm the Assistant Chief responsible for emergency management at the City of Winnipeg. As Omicron spreads through our community, we all have a role to play in limiting its spread. Please get vaccinated and follow the public health orders to keep everyone safe and protect our emergency responses and our hospital capacity. If you are sick, do not visit our facilities or ride on the bus. Stay at home. The City of Winnipeg is facing increasing staffing challenges due to COVID-19. As of today, there are 351 active cases of COVID-19 in our workforce, including 76 in Winnipeg Transit and 85 in the Winnipeg Fire Paramedic Service. Our priority is on keeping our employees and residents safe and ensuring the appropriate policies and procedures are in place to support the continuity of our essential services and the ongoing maintenance of our critical infrastructure. Civic departments are making operational decisions to ensure the continuity of services and minimize impacts and disruptions. Winnipeg Transit is using spare operators and overtime to cover absenteeism currently. Unfortunately, we have not been able to cover all shifts. To mitigate impact to the overall service, we've had to cancel some runs. Transit customers, please check your schedules each time you ride, as some routes may be experiencing service disruptions. The Winnipeg Fire Paramedic Service has been able to backfill most shifts using overtime, and units with lower utilization rates are being redeployed to ensure the most minimal impacts possible on our emergency response times. Operational planning and decisions pertaining to our paramedic services are being made in consultation with our medical director and the Shared Health Chief Medical Officer for Emergency Response Services. The Winnipeg Fire Paramedic Service continues to use all the tools in its toolbox to support patient needs, including leveraging firefighter paramedics and diverting non-emergency calls to our community paramedics. We will continue to be there for any resident in distress. If you are experiencing an emergency, call 911 and we will respond. We will continue to assess any potential impacts to city services, and we will make operational decisions as required, and appreciate residents' patience as we work to deliver these important services. Take your questions. Okay.
Reminder that you get one question and a follow-up. We'll start with James.
Happy New Year. Are there any specifics about which transit routes were affected?
I don't have specifics, James, in terms of which transit routes, but based on daily needs, we are on occasion having some buses that aren't running, but the management team and leadership team of transit is spreading out those routes out. So an example would be that one bus in the morning that would come every 4 minutes. One of those buses might not, there might be an 8-minute gap between that bus is an example. So.
Hi, just wondering, Easter job, are programs still moving forward?
Sorry, Jeff, can you repeat? I think you said something about programs, but you were real quiet there.
Sorry, Jeff, you're cutting in and out on our audio here. Do you mind trying again?
Yeah, can you hear me now?
Yeah.
Okay, leisure guide program, is it still moving ahead?
Yes, at this time, right now, there's no changes to leisure guide.
Okay, thank you. And Mayor Bowman, you touched on it.
Yeah.
But, I mean, are you concerned that, as this moves forward, especially for emergency services, and specifically the police, after what we heard yesterday, that, the city could be in a position where, there is going to be an issue with responding to every critical call?
Absolutely, we're following very carefully, and that's why I appreciate the update that we're getting today from our public service. Yeah, I mean, right now we're watching very carefully. One of the reasons why the city has proactively instituted a vaccine program for all of our employees is to help mitigate the risk and the potential impacts on our critical services. The chief, Winnipeg Police Service chief, has certain levers available to him in the collective agreement, which I understand he triggered yesterday, support his efforts to manage his workforce and the operations of the police service, which is within his purview. He has my support, of course, to do so. We're currently not seeing the need for that lever to be pulled in a similar way. Our public service has available tools to manage staffing levels in other city services, including within the Winnipeg Fire and Paramedic Service. But we'll continue to watch and make decisions going forward as needed. But the short answer is, the staffing levels, we're seeing it throughout the community right now, not just within government. Of course, critical services that a municipal government provide are particularly important, especially when it comes to emergency services. And so far, we've been able to manage, as best we can in the current circumstances. And I want to thank all of those that are working within the public service, including in our emergency services, for having got their vaccines, but also just for the work that they're doing right now.
For the transit routes, how many transit routes were canceled already, and how many more do you expect to cancel going forward?
Oh, great question. I know this morning, I think there were 3 buses that didn't operate, but it's on a daily basis depending on what the sick call in and how many overtime drivers we can get on the spare list. On occasion, there's more than 3, but it's been sporadic, changes day to day. So, and again, the transit leadership group has done a really good job with their continuity plans to spread out throughout the city. So an example might be, I grew up in Charleswood, so I know the 79 route. So if the 811 in the morning bus, that 79 route comes, the next one might not come, but the one right after is coming. So that's sort of an example where, you know, we're not removing a route. You're not going to lose all the routes in North Winnipeg or in Transcona. They've done a really good job of managing throughout so that there's appropriate level of service throughout.
So, sorry, just to clarify, before I move on to my second question, then when you say 3 buses didn't operate this morning, you mean at 3 scheduled time slots, they didn't?
Yeah.
It wasn't that a whole bus route was canceled for the morning or anything like that?
Yeah, correct. Yeah,
Okay.
on a daily basis, it'll change. So on occasion, I think a couple days ago, there was a few more than 3. But so right now, leadership group in transit doing a good job. We are having staffing impacts, lots of illness, absenteeism like we're seeing in all sectors, but it's stable and we're managing.
Okay, and at this point, do we know how long this is gonna last? Do we have any idea based on when people started calling in sick, or is there any kind of prediction you can give?
Yeah, so the best prediction that I can give is that as we see case counts rise in the city of Winnipeg staff, we know that right now we're going through a bit of an isolation period of 10 days and looking at that 10 days down to 5 days and working with the province to determine what that's going to look like. So as staff become symptomatic and test positive or are symptomatic in calling in sick, we know roughly right now that in 10 days we get those staff back. So we're sort of cycling through, and as we get more cases, there's cases coming off the back end, and we know those employees are coming back. And I want to thank our employees because we've had just a ton of employees, all sectors, that are coming and showing up every day, and they're doing their self-screening, and they're coming to work, and they're providing those critical services. So this has been challenging for everyone, and just want to shout out and thank our employees.
Mohammed?
Hello to both of you. I was wondering, what are the next steps if the situation is worsening? What are the next steps for you?
Yeah, that's another great question. So you heard our mayor talk about levers, and you heard us talk about terms like business continuity plans. Every department has levers and operational strategies and tactics that they can use. Some of it could be cohorting or platooning, making sure that we are maybe changing schedules, increased PPE, working with our occupational health and safety teams, changing routes and schedules of activities, frequency of activities, lots of levers that we can pull if we needed to. Currently, right now, we have no critical service failures in any of our departments. It's strained. I'm not going to lie. It's strained. We have a high level of absenteeism, but our leaders are leading and our continuity plans are working. I'm going to knock on wood right now and hope that it doesn't get any worse. But, you know, we could, you know, call in more overtime. There's lots of other levers that we could be doing right now. But right now, we're stable. We're monitoring every day, and it could change in the next 12 hours. So we're doing it right now, and we're getting through it.
I'll just add to that, Mohammed, that our Emergency Operations Center was activated in, well, it's coming up to, this March, it'll be 2 years of activation. It hasn't closed since the beginning of the pandemic, and that effort is led by Jay Shaw. His team, our public service, they've been working throughout the holidays to ensure that the planning is constantly evolving as need be based on how conditions are changing within the province. And so Winnipeggers should certainly take some comfort in the planning and the team of the public service to ensure that the Emergency Operations Center efforts are happening in real time. what we can do as Winnipeggers to support those efforts and to support the issues of staffing is to limit our contacts. Limit our contacts, go get your shots, get your booster when you're eligible. This is a way that Winnipeggers can ensure that they're helping mitigate impacts on critical services. You may not need those services directly yourself, but others in our community will. And you know, I've heard a lot, certainly online with some of the trolling from anti-vaxxers and others about rights. We do have rights in Canada, but we also have responsibilities in a civil society. And part of those responsibilities ensure that we're taking the advice of provincial public health officials, that we're doing our part to go get vaccinated and to limit our contacts. And that's what I'm asking Winnipeggers to really increase our focus on limiting contacts and making sure that you and your loved ones are getting vaccinated and getting your booster shot when eligible. There's rights, but there's also responsibilities in a civil society, and we need to exercise those as Canadians now more than ever.
Thank you very much. And I was wondering, for example, for transit workers, if you need it, can you hire from outside? Can you hire workers for the transit from outside if you are needing it?
Yeah, so transit is always, you know, like many departments in the city, we're always going through recruitment processes. I'm not sure what the state of the recruitment process is currently with Winnipeg Transit, but there's extensive training required. We can't just, you know, pull someone off the street and give them there's a lot of training. It's a profession. You got to be safe. So the short answer is no, we can't just grab someone off the street and tell them to drive a bus. And we can maybe look and get you some more information on follow-up on the recruitment efforts of Winnipeg Transit. But that leadership group, I meet with them daily, and let me tell you, they're working in the backgrounds, and they're providing an amazing service right now. So they're doing good work.
Thank you.
Back to James.
Oh, I didn't get a question.
Oh, I'm sorry, Sam. That's my fault.
That's okay.
I can wait. I
Sam,
can wait.
you're next.
Yeah, thank you. Good morning, everyone.
Good morning.
Hearing anything about reaching out to vulnerable populations as far as the COVID-19 efforts go from the city. So what is the city doing right now? Or are you bumping up any supports that you're giving different organizations? So
Yeah.
vulnerable populations specifically.
Yeah, thank you for that question, because that's obviously a pretty important question in our community right now, especially during the extreme cold that we're having. Firstly, I just want to thank End Homelessness Winnipeg. They are providing updates to provincial officials as well as city officials on a regular basis. There's ongoing outreach that we're having through the public service to End Homelessness Winnipeg, as well as some of the agencies that are helping to protect our most vulnerable. And maybe with that, I'll let Jay provide a more substantive update.
Yeah, thanks for that, Mr. Mayor. What I'm hearing from End Homeless Winnipeg and from our shelter organizations, they are experiencing the same type of staffing challenges that many organizations, NGOs, private businesses, and government are experiencing. I have not heard of any critical failures at this point. It's challenging. It's cold outside, and those shelters are providing amazing service and doing the absolute best they can to protect vulnerable residents. So we're here to help, and we have not had any reach out to say that there's been any critical failures at this point, and we are in almost daily conversation with End Homeless Winnipeg and those shelter organizations through our Emergency Operations Center and our staff that are engaged with them.
Thank you. The follow-up there is, in terms of emergency operations, then Mr. Shaw, like, is the city planning on opening up any extra spaces for people to stay warm, such as libraries, even considering the staffing shortages that we're seeing? Yeah,
so right now, libraries and our rec centers and all our centers are open because the public health orders allow for that. So those are places that anyone can go in to seek respite out of the cold. Currently, right now, we don't have any additional spaces open. If there was a critical failure of service, or something happened at one of the local shelters and they needed support, they would reach out. We do have strong planning with them, and if there was a need to be able to provide more service, we would be in consultation with them through a unified command process and look to be able to provide that support. But nothing is open right now in addition.
just a quick question here. Just wondering, as of this morning, is there a shortage of police patrols?
I think you'd have to go back, James, and ask Winnipeg Police Service in terms of their daily staffing. That would probably be the best place for that question.
Fair enough. Mr. Mayor, have you heard anything?
No, I haven't. I spoke yesterday with the chair of the Winnipeg Police Service Board, Councillor Chambers, and I want to thank him for his leadership and efforts as well as that of the board. Ultimately, the operations of the police service are managed by the police service itself, and so to Jay's comment, that question would be best directed to the Winnipeg Police Service. But I do appreciate, and the reason I support the chief's efforts that he announced yesterday to manage his workforce to ensure that that general patrol and the obligations of the police service to be there are best met under the current circumstances. So I want to thank him. I want to thank the members of the police service for their efforts too. I think changing roles and adapting, I have no doubt is difficult and not ideal, but appreciate the work that he's leading to manage the police service.
Thank you.
Jeff, did you have another question?
Just quickly on transit, what's the percentage transit's running again right now? What are we running at operationally?
So I think we're at 94% of regular buses on the road. And this morning, I think there were 3 buses that weren't able to operate due to staff shortages. Does that answer your question, or are you looking for something a little bit different?
Nope, that's it. And just lastly, Jay, we're seeing the province mandating medical mask use in schools for staff and the 3-layer, I guess, those disposable ones for students. Is there anything for the city, like either recommendations or mandates for mask use for employees?
Yeah, so that's a great question, and just to talk a little bit about that. So we have an extensive occupational health and safety branch that works inside of our emergency operations center, and we do critical risk assessments on the needs based on for the operations of each specific job, function, and task. So what does that mean? It means that certain specific jobs require a higher level of protection. Our paramedics, they're going into medical calls with COVID positive patients. They need the highest level of protection of PPE. So we do assessments and then we determine what's available. Right now, Winnipeg Transit has access to double masking, triple masking, medical masks. Many of our different departments have access, depending on the critical needs and assessments, to respirator masks, which are those N95s that you talk about. So it really depends on the level of service that's being, and we do have stock right now, but stock is running out. We're in the same boat as everyone else. So we're doing our best with logistics to maintain our stock of PPE, and right now we're managing. So if departments need additional stock, they reach out and we provide.
So carrying on with that transit, the union yesterday revealed that it's sent a couple requests now to both the city and the province. It wants more KN95 masks for drivers, medical masks for staff, rapid test kits, emergency funding for overtime, set bus capacity limits, and mask use enforcement. So will the city be providing any of that? I know that they are going to do the surgical mask, because that was confirmed to me yesterday, that starts today. But other than that, are we going to grant any of those requests?
Yeah, so let's just sort of focus on the terms here. Medical mask, that ATS level 3 mask, is what has been provided. That's a very high grade, high quality mask. And when you double mask that to be able to get that seal, that provides a very large level of protection. We are working with our occupational health and safety folks at Winnipeg Transit to determine if there's a need for those N95s. You have to understand that those N95s are respirators, Joyanne, and you need to be properly face fitted for them. So we are working to see if that's something that we can do to implement. But there's things that have to change on that. For example, if you were issued a respirator mask we have to have a clean shave policy. There's different things that have to be sort of worked out because you need to be able to create that seal. So again, our occupational health and safety branch working very closely with all department leaders to be able to provide the best PPE for each department based on their risks.
And then for the other parts of that question.
Yeah, so they already, rapid tests right now, we're currently working with the province of Manitoba to be able to secure rapid tests for critical staff, and we are working through that right now. So thank you to the province who's trying to get rapid tests out from the federal government and their stock. We're working with them right now. And right now we are using overtime. So there is overtime provisions for all areas where we're providing critical infrastructure services like transit and water treatment plants and emergency services. So we are using overtime. So I want to thank ATU and their members. They're showing up every morning to drive the buses and provide that critical services. And, we're going to work together with them, and they're working with our transit leadership to be able to address these questions as well.
I guess the other end of that was, but I know it was a long question, sorry, but bus capacity limits and mask use enforcement, because there haven't been any tickets given out for riders who don't wear masks.
Yeah, we're at about 99.5% compliance for mask use on buses, so pretty close to 100%. There are public health orders that say that for some individuals that aren't able to wear masks. So, in some cases, there are, a youth under 5, I believe, and there's other rules around when you don't have to wear a mask on a bus or anywhere really in the public or indoors based on public health orders. And currently, right now, ridership on transit is still flexible in that 50%, 60% type of usage compared to sort of 2020, 2019 ridership levels. So there's still ample space on buses. There are the odd occasion, Joanne, that we've seen, rush hour traffic, things like that, where there's more than, for a short period of time, 1 or 2 stops where there's, more people on a bus, right? But for the most part, what we're seeing is numbers are relatively low, and we have kept 94% of the service on the roads to be able to make sure we can have that social distancing and physical distancing. So at this point, there's no changes to that. And I don't know if the mayor has anything to add on that. So
I think I know there were a number of asks. I mean, one was more buses, but right now the issue isn't more buses. I mean, buses don't get COVID, people do, and so the focus for the public service has been on how do we mitigate the risk to our transit operators, but also to riders, while keeping the buses rolling for the purposes of those that need to get to and from work, of course. Many in our healthcare sector take the bus to places like the Health Sciences Center and elsewhere, and so we've invested more this most recent budget, which I know you're familiar with, Joanne, because you covered it. But the investments for transit are significantly up because of the critical service that it provides to our residents during a pandemic and beyond. And so the focus will continue to be how do we mitigate the risk through some of the measures that Jay has just reviewed with you.
And I guess my second question then would be, how many drivers are now off for transit, and how many are also due to actually having COVID, and then also for COVID-related reasons like isolating or waiting for a test or whatever?
yeah, I don't have that in front of me. Let me see if we can get you that data in terms of specifics on transit, or if we're actually releasing that. We'll take a look. We have to be able to sort of look at all that data and see what's there. So I'll try and get back to you there on that one, Joanne.
Yeah, I'm just thinking those are the 2 numbers the police put out yesterday when they discussed their staff shortage, so that would be a good comparison to have, right, for what we're seeing now. Okay.
Mohammed, did you have another question?
No, I'm good for today. Thank you.
And Sam, did you have a question?
I do. So WFPS, Mr. Shaw, you mentioned 85 people are off with COVID. Yesterday, communications folks told me 77, so this is growing. I'm just wondering, like, I'm not sure the percentage there, but why would the WFPS not call a state of emergency? Well, Winnipeg Police Service has. It seems like, everyone's out there. They're all first responders here.
You want to start?
So how do you square that?
Yeah, the state of emergency that the chief of police called is a very prescriptive measure within the collective agreement that's specific to the Winnipeg Police Service. And so we have declared a state of emergency previously. You know, if and when that's necessary, I have no problem declaring a state of emergency if there are additional measures that can be gained from calling it. Right now, the public service, you know, I've spoken with, and members of council today were briefed by Jay Shaw, but also our Chief Administrative Officer. Our CAO has the tools that he needs right now to manage the workforce throughout other city departments. The police is unique in that the operations of the police service are managed exclusively by the police service itself, just given the Police Services Act, and that's something we obviously respect. But within other departments like the Winnipeg Fire and Paramedic Service, the levers to allow the public service to manage the workforce are available that they need right now. But if and when conditions change, I have no hesitation to call a state of emergency if it can help address staffing or other needs in the workforce and in the community going forward. So it's something we're obviously watching quite carefully.
And what's that level for police? They said around 10% absenteeism.
Yeah, so right now, I think we're somewhere between 4 and 5% of Winnipeg Fire Paramedic Service staff that, you know, like you said, they're absent with COVID and in situations like that. The Winnipeg Fire Paramedic Service is strained right now, but it's stable. We are answering all calls for 911 on a priority dispatch system, and we are providing those critical 911 services. And we have many levers left in place. And right now, if you call 911, you're going to get a paramedic, or you're going to get a firefighter paramedic, and your call is going to be answered, you know, triage like it normally is. And I'm not going to say that we're not under strain. All departments are, all NGOs, all private businesses. Things could change. When I look at what I'm seeing happening in Ontario and I'm seeing it happening in Quebec, and what we've seen and how we've prepared based on the other 3 waves, we are prepared to take more steps if needed. But right now, Christian Schmidt, our chief of the Fire Paramedic Service, is leading, and our Fire Paramedic Service is under strain but stable, and we are answering 911 calls, and Winnipeg residents can rely on that right now.
I have one last question I think is relevant to everyone. 48% test positivity rate in the city of Winnipeg. What do you say to folks who think, you know what, this just seems inevitable that I'm going to get COVID-19? What's your message, Mr. Mayor?
Well, yeah, I mean, that number is staggering. I appreciate you highlighting it. I mean, it is, this variant is so transmissible, and we're seeing this wave, and we've been seeing it for some time. Obviously, Ontario is noteworthy in terms of what they're dealing with right now. I guess the message is you know, I provided the statistics that we're getting from provincial public health officials on the value of getting your vaccine, because you know, you hear people say, well, what's the point of even getting the vaccine? It's out there. You know, when you hear some of the statistics, like, and I'll just highlight one of them. You're 30 times more likely to die from COVID if you're fully unvaccinated. Not 2 times, not 5 times, 36 times more likely to die. So, you know, for many months we've, and I'll continue to do this, tried to appeal to people's civic duty. Like, do your part. You know, we hear about rights, but there's also responsibilities in a civil society. Go out and get your shot is one way in which you can do your part to help the community weather the storm. But the reason I'm highlighting these numbers that we're getting from provincial officials is if some people are only motivated by looking after themselves, well, okay, there's reasons to go get vaccinated. 2 times more likely to test positive, 14 times more likely to be hospitalized, 39 times more likely to be admitted to an intensive care unit if you're fully unvaccinated. So what I would say to those that are unvaccinated, go out and get your shots as quickly as possible, get your booster, but also limit your contacts. You know, the key thing that I'm watching is the capacity in our healthcare system and the impacts on people that don't even have COVID. We're hearing far too many people that need medical procedures that aren't getting the healthcare services that they need. And so when I see and I hear about people holding parties in their homes, like really just pretending like it's everything is just fine, it angers me to no end, because we have to think about those in our community that are being impacted as a result of what can only be described as in some cases, as very selfish behavior. And so if you're not motivated by that, get motivated by limiting your contacts and limited and some of the statistics on how you could be impacted if you don't have your vaccine. But even if you have your vaccine, so I got my booster shot with my wife Tracy yesterday. We're still, we've made changes to our plans over the holidays. There were certainly plans that we were really looking forward to seeing people in person that we just didn't. We're limiting our contacts and limiting, the potential exposures, if only to try to help provide some additional support to our healthcare heroes right now in our hospitals and our intensive care units. They need the support from Winnipeggers.
Does that anger and frustration build when you think of all of the work that city employees are doing to try and, mitigate absenteeism?
It does. I mean, that being said, the majority of Winnipeggers are doing their part. The majority of Winnipeggers are going and getting their shots. They're stepping up and getting their booster shots now. They are limiting their contacts. I'm asking everybody to kind of redouble your efforts to limit your contacts in particular. We'll continue to advocate at the provincial government, provincial level, for measures that they can take that can be more coordinated throughout just the capital region in particular. But as much as, I know many of us are frustrated with the behavior of certain folks in our community, I think we should take some comfort in the fact that the vast majority of Winnipeggers, Manitobans, are doing the right thing, and they're doing what they can to help.
James, did you have a follow-up? James, Jeff, did you have another question? Final question?
Just quickly, Jay, you said there's 351 active cases. Do you know how many people though are off on COVID-related leave who may be, close contact, isolating? Similar number of police put out yesterday.
No, we have 351 active cases, and then we have other numbers of illness, but that could be illness for anything. It could be you sprained your ankle. It could be, any level of other absenteeism. But where we're seeing the spikes is in that absenteeism for COVID positive and for self-isolation. So does that help? I don't have that number of how many people are off on self-isolation or other illness at the moment.
Okay.
Did you have a follow-up, Jeff?
No.
Joanne, did you have another question?
Yeah, for, obviously we're seeing the transit service reductions now. Are any other city services going to be reduced due to staff shortages at all?
Yeah, good question. At this point right now, we don't have to pull any of those levers, but if we were to continue to see increased staff absences, you could potentially see some reduction of services, and depending on what it is. So an example might be on occasion, based on staff shortages, the odd pool is opened a bit late, or the odd library is opened a little bit late, or closed early, or things like that. So you could see a pool closed, or you could see a recreation facility closed, depending on staff levels. But again, right now, strained but stable. Our Director of Community Services is leading every day, and the continuity plans are working. Want to thank all of our staff over there in Community Services and Recreation. They have been champions throughout this, as all of our employees have been. But again, strained but stable, and if we do see more absenteeism, we might have to look at of things like that, like sporadic closures of some facilities.
And this is sort of not related to today's announcement, but something, emergency management question as well. There's a report out calling for some water fill stations to be added for extreme heat waves, sort of a pilot project. Do you, I guess, why is the emergency management office wanting that to be added for vulnerable?
Look at the impacts of heat, cold, and extreme weather, and what we need to do to be able to better prepare. Providing the water systems and those fountains or portable drinking options right now is just one part of the solution in terms of being able to provide additional services to our residents. And you know, we went through a heat wave this summer, and what we found was there was a real need in our vulnerable populations in downtown, in actually all sectors when we looked at where we were handing out bottled water, and making sure that people stay hydrated and getting that message out. So it's one part of the solution. As we see climate change and as we see these increased hazards, you know, we're going to need to continue to act more and do more from our Emergency Management Operations Center and to continue to support Winnipeggers. So it is important, and you know, you bring up a good point. We're in the middle of extreme cold right now, so it's kind of the opposite. But you know, you've given me a little bit of hope that we can get to some green grass and some warmer weather and get out of this phase of COVID. And I hope we don't have those types of heat waves again. But we need to be prepared for these changes in environment and in these extreme weather events.
The modeling that we've seen on the effects of climate change in the prairies in particular, Joanne, that I've seen from the University of Winnipeg, they've done some really good work. You know, cities like Winnipeg, Brandon, Regina are particularly affected by climate change. And so notwithstanding the fact that healthcare, social services, housing are areas of primary responsibility for the provincial government, you know, there's still a role for us to play, and I appreciate the planning that our Emergency Operations Center is doing during a pandemic, but also, of course, for extreme hot weather. So extreme cold and hot weather is obviously something we have to manage.
Okay, thank you.
Mohammed, did you have another question?
I'm good.
And Sam, did you have another question?
Yes, I have a clarification question. So 351 active cases in the city's workforce, I guess, A, does that include Winnipeg Police or no?
Yes.
Oh, okay.
Oh wait, let me just check. Let me go back and we'll get you clarification on that. I don't know if my math had the police statistics in it today. Sam, we'll get you that information, okay?
Okay, great. And then, I mean, the other part of that is 351 out of how many people total?
We have approximately 10,400, 10,500 employees.
Okay. Yes, I think those are all my questions. Thank you.
Great, thanks. Jeff, did you have any final questions?
No.
And Joanne, did you have any final questions?
I think all of mine, I'd have to follow up by email because we need to check on, so I think I'm good.
Great. Mohammed, any final questions?
Nope.
And just to make sure, Sam, any final questions?
I do actually. Is there modeling that you're basing, like, that you're trying to look ahead for staffing shortages at all, or you're just kind of going as it goes?
I think it's been pretty clear over the 3 waves as we see what's happened in the prairie provinces. You know, in the first wave, it kind of came from both sides, west and east. And as we got into wave 2 and wave 3, you know, you can kind of see what's happening. We've been sort of following Omicron as it started in Europe and sort of watching and working with medical experts and the province of Manitoba. You know, and that's sort of the modeling that I'm working on right now is off of that. I'm very carefully, our planning department, we have a very robust planning department that looks at sort of, you know, what the statistics are and what's happening in Quebec and Ontario, and getting an understanding. We are in constant conversation with provincial counterparts We have an emergency management group that talks to emergency managers all across the country. So we have a pretty decent way to be able to just sort of have a rough estimate of what we think is going to happen. Manitoba is no different than other provinces in terms of Omicron is not going to, pick on one province more than another in some ways. So we're going to get what we're seeing in Ontario and Quebec. And we do expect increases right now of Omicron in Winnipeg. And that's why I say, that's why these continuity plans and why we've been doing them. So, we're not out of this yet. We got a few weeks, Sam, to, I think, to hold on tight.
Right, but I guess what I'm asking is the city doing any specific modeling? Like in Toronto, their worst case scenario is 50 to 60% absenteeism. Does the city have any, or are you working off, as you mentioned, provincial?
Yeah, working off of provincial information that we have. We don't have any specific modeling per se in terms of estimates of what our employees. Our business continuity plans do take into consideration different levels of absenteeism. So 10% absenteeism, do this, 20% do that, things of that nature, right? So, but when you speak of Toronto, Toronto runs things a little bit differently in terms of they have a very robust health department inside the city of Toronto with about 1,000 employees. So they have physicians and doctors and epidemiologists. So that's a function that the province of Manitoba runs here in the province of Manitoba.
I actually had the opportunity to, part of my efforts over the course of the pandemic has just been comparing notes with counterparts across Canada. So I met recently in Toronto with the Mayor of Toronto, Mayor John Tory, just to compare. It is different. The structure at the provincial level is different in Ontario than it is here. Here, health really does reside within the provincial government. Earlier today, I spoke with the Mayor of Calgary, just again, comparing notes about how we're managing at a municipal level when most of the levers that are being pulled from the healthcare sector in at least our two provinces are at the provincial level. So it's helpful just to also get a sense of what we can anticipate kind of washing upon our shores given what we're seeing in other provinces. And right now, Alberta is obviously dealing with this wave as well, and Ontario is, I think, a little ahead of us based on the numbers that we're seeing. So in anticipation of what has yet to come here, is behind some of the appeals that we're making today for people to limit their contacts and go get vaccinated.
Okay, thank you.
Okay, thanks.
Okay, I think one that concludes today's press conference.
Okay, thanks everybody. Have a good day.
Thank you.
Thanks, Joanne.
Reporters, before you leave, I just want to double check that the live stream is done, Jason.
I think so.
Okay, sorry, Jason and I, it's Felicia, Jason and I swapped accounts today. The 351 number that Jay was citing is inclusive of police.
For active cases.
For active cases, yeah, so that